Hey everyone, this is Dr. Tyler. I just wanted to send you a quick video just briefly discussing what the COVID-19 or coronavirus is and what it's going to mean to us. So the very first thing I want to talk about, just kind of where did it come from? There's a lot of information out there. It actually came from a city called Wuhan in China, and it actually originally came from animals. And there's been some diseases like AIDS and other things that have seemed to cross the barrier from animals to humans. This one did late last year, and that's why we haven't really heard of it. They're actually beginning to call it the novel coronavirus because it's new. It's not been seen in humans before, which is why some people are really afraid. They're scared. They're not sure how bad this might get. However, if you look at the actual cases for the U.S., there's been about 4,500 people so far confirmed with coronavirus. Now, of those, there's been about 85 that have died, and that's about a 1.8% current rate of death for this particular virus, which is higher than we like, but definitely not as high as they were afraid it would be. In Oklahoma, just so you know, here in our state, there's only 10 cases currently reported, and there's been no deaths. Now, people are asking how severe is this thing? So I will tell you, the reports online say that about 80% of cases are considered mild. They're very much like having the flu. They're very much just like being a normal sickness. About 15% are severe. There's a shortness of breath, a lower oxygen level. Some people maybe need to be put on oxygen or have some intervention. And then about 5% of these actually go critical, where they need hospitalization, may need to be on a ventilator. And then again, 1.8% unfortunately do pass with this particular disease. So let's talk for a moment about the difference between the COVID-19 or coronavirus and the flu, because a lot of patients don't understand the difference and they don't know what they might have. So they're both kind of a hallmark. The fever, high fever, muscle aches, just not feeling well, really common with both of these viruses. However, the flu, one of its hallmarks is like a runny nose and a sore throat. Those are seen in less than 5% of the COVID-19 or coronavirus cases. Way more common is something like a dry cough, which means you're not coughing up anything. And then there's also, unfortunately, these do tend to progress to pneumonia, which is why this is so problematic for the older population. Children don't seem to be nearly as affected by this particular virus, but older population, 60 plus, especially people in the 80s plus, seem to be more affected, which is likely because it's a much higher incidence of things like emphysema or COPD in that population, which makes them a lot more susceptible to this particular virus. So how do we prevent getting the coronavirus in the first place? Well, a lot of the things you're going to hear are very similar to what you would do for the flu, things like hand washing, hand sanitizer. So the difference in those two, again, hand washing is superior. Going into the bathroom, cleaning your hands thoroughly, washing them under hot water does work significantly better than hand sanitizer. But if you're out, you're on the go, you're not maybe where you can get to a bathroom, then hand sanitizers do work, although they're not as effective. They tend to slow down their growth. They're not quite as good at killing it. Definitely clean common surfaces in your home or your office that people come into contact with. Now, there's a difference between cleaning and sanitizing or disinfecting. Cleaning is when you wipe off the surface to get all the dirt and grime. That is super important, but it's not the same as disinfecting or sanitizing. You always should clean first. Clean off the area, get all the junk off of it, get all the stuff off of it. Then go back and sanitize it. Lysol. If you want to make some home stuff, again, Lysol is kind of flying off the shelves. Now, if you had a third cup of bleach per gallon of water, that is considered adequate for disinfecting for the coronavirus. Again, just make sure the bleach will not harm whatever surface you're putting it on, and that should be fine. Definitely if you're doing laundry, if it's something that can be washed in hot water is way superior, and it's going to definitely get that coronavirus way more likely to die. Now, if the coronavirus is as easy to pass on as they claim, most people at some point will come in contact with it, and the important thing is to make sure that you're ready for that and get your body ready to battle this disease. One of the reasons they're doing the social distancing, the quarantining, all these other things, they're canceling flights, isn't to necessarily prevent anyone from catching it. They need to slow it down. It's not that we couldn't handle in the U.S. A million cases of this coming through effectively. We just can't handle a million cases at once. There's just not enough beds and not enough doctors to handle that. And so slowing it down is important, but the real thing is what happens to you when you finally come in contact with this virus? So a couple of things you want to make sure you do. An easy one is just get adequate sleep. If you are sleep deprived, if you are not getting an adequate amount of sleep, there's been multiple studies that show it definitely opens you up to the possibility of getting any sort of sickness, but this would definitely be included. Vitamin C, the National Institute of Health, shows that it actually supports cellular function of the immune system. So it's supporting your immune system in big ways. People ask how much to take. Honestly, unless you have a kidney issue, your kidneys can pretty much eliminate the majority of anything you take excess. You should never take more than 2,000 milligrams in a day. 1,000 milligrams a day is what I currently take, and that seems to be fine. My kidneys have no issue with that. The kidneys within a few hours typically will remove any excess. Now, the other big one's vitamin D. Now, vitamin D is given to you from the sun, and let's just be honest, most of us are not getting in the sun right now. So vitamin D is critical. It helps modulate the immune response. It helps your body actively go after these viruses. Now, we've been using vitamin D a long time. We just didn't call it that. If any of you people are my age or older, you're going to remember as kids potentially taking cod liver oil. Well, one of the reasons that was so effective is because it's incredibly high in a good source of vitamin D. You want to always make sure you're taking it with potassium. So most people should be on a multivitamin anyway, and most of those do include potassium. But particularly the type of potassium for this is K2. There's a lot of vitamin D3. So D3 is the type that humans can actually use. Is combined with K2. So if it's not, just make sure your vitamin D, if you're not combined with potassium, do take that. 4,000 to 5,000 units a day, they're measured in IUs. Typically is safe unless you're a child or if you're pregnant. And I would suggest cutting that in half if you are one of those cases. There are some drug interactions with vitamin D, so just make sure you're not on one of those drugs. I know there's a couple of statins, some other things that may affect it. So just look at that before you start taking anything. Another thing that's been very popular for the flu, especially in recent years, is elderberry. Now, according to Science Daily, they had some people from the University of Sydney, some biomolecular engineering researchers, that showed that taking elderberry had potent antiviral properties, and it was very effective against the flu when taken. Now, since this is also a virus, the COVID-19 or coronavirus, it should also be effective against that to some extent. So the last recommendation I have is chiropractic. And for some of you that may be surprising. How does chiropractic help your immune system? Well, studies have shown, particularly in immune deficient people like AIDS patients, a 200 to 400% increase in immune function. Now the 400% increase was for seriously sick people. 200% was shown in healthy people. And so getting an adjustment can actually help your immune system function according to that study. Another one is it reduces your fight or flight response. So your fight or flight is what should happen if an enemy is attacking you, you're getting harmed, somebody's chasing you. It's supposed to make your heart rate, it shuts down digestion, it diverts blood flow away from your hands, your feet, to more important organs to make sure you are able to either fight or you can run. Like that's the only two things it wants you to do. Well, the problem is they've shown that if part of your spine or body is subluxated, is misaligned, is stuck or fixated, it artificially can stimulate that system because of it. There's an injury, there's damage. Well, chiropractic has been shown that if you can release that, it seems to help cortisol levels as well, which is what's produced by your fight or flight system. Now, if cortisol is too high, that is definitely shown to be an immune depressive. It lowers your immune system. The other part is most of your immune systems, like 70%, comes from your gut. Now, for those of you who don't already, especially if you've been on a recent antibiotic, most people should be taking a probiotic, especially if you eat a lot of antibiotic-laden meat or other things. A probiotic seems to be very, very beneficial, not to mention the immune help. However, the number one condition that people see chiropractors for is lower back pain. Well, how does that relate? Well, lower back, the nerves in your lower back, if you look here, they lead into your intestinal system. They lead into your gut, into your colon. Well, these nerves, if they're being impinged, if they're being damaged, if there's pressure on them, has been shown to potentially slow that all down. Well, if your gut makes up 70% of your immune system, you can imagine that might have a major effect. So one last interesting story actually happened about 100 years ago. Through the U.S. and through the world, we were just devastated by something called the Spanish flu back in 1918. Now, worldwide, it was thought to have infected 500 million people, which is an incredible amount. Deaths in the 50 to 100 million range. I mean, this thing was really, really bad. In the U.S., it was thought to kill nearly 700,000 people, which is actually more people than even died in the Civil War. This thing was a bad deal. Now, at the time, chiropractic had only been around for 20, 25 years. It was pretty new. And honestly, it had been pushed to the edge of near extinction through political and some other means. So we were struggling. And what was interesting is after the flu had gone through, what they found out is a lot of chiropractic patients seem to have weathered this flu really well. And in fact, if you'll permit me, I'm going to read you a quote from a doctor from back then. He says that I was about to go out of business when this flu epidemic came. But when it was over, I was firmly established in practice. Now, why? The answer is reasonably simple. Chiropractors got fantastic results from influenza patients, while those under medical care seemed to die like flies all around. Now, guys, it wasn't that the medical doctors were doing anything wrong. They were doing their best. Simply back in 1918, honestly, we still didn't have full running water. Our sewer systems weren't fully up to date. Like the amount of drugs and amount of interventions they had were very limited in scope. The things like that we take for granted, like having portable oxygen or being able to put somebody on a ventilator, guys, there just wasn't a lot of that back then. So there's a lot of handicapping for the medical community to take care of these people. Chiropractic, though, we work with what's already inside of you. We're boosting your natural immune system, which has been around for thousands of years. It seems to work really, really well. To give you some numbers. In Davenport, Iowa, 50 medical doctors treated about 4,953 cases with 274 deaths. In the same city, 150 chiropractors treated 1,635 cases with only one death. So you can see that the rates of death are quite a bit different. Now, just to give you an idea, in Oklahoma, in the same epidemic, reports show that chiropractors in Oklahoma treated 3,490 cases of influenza with only 7 deaths. But the best part of this is, in Oklahoma, there is a clear record showing that chiropractors were called in 233 cases where medical doctors had cared for the patients and had finally said there's nothing more we can do. And all but 25 of those patients ended up surviving. So there's some historical evidence that show chiropractic could be very, very beneficial in times like these. Now, guys, here's the thing. Don't panic. We're going to get through this. It's going to be okay. We love you guys. We're praying for you. We will be open unless they tell us we have to close. But if we're there, we are there to serve you, and we hope to see you soon.